This study covered the prevalence incidence of Brugada pattern in the US. This is the biggest and the most comprehensive prevalence study of Brugada pattern. Hello everyone, I am Dr. Patara Ratanawong. I am the cardiac electrophysiologist at Hawaii Pacific Health, Honolulu, Hawaii. Today I'm going to talk about our new article that's going to be published in Mayo Clinic Proceedings, January 2025, Prevalence and Incidence of Type 1 Brugada Pattern, a 30-year experience at Mayo Clinic. We review 5 million ECG, include 2 million patients that present to Mayo Clinic with at least one EKG, and we review all the EKG in the past 30 years since Brugada syndrome was described in 1992 until 2021. So we look at Mayo Clinic patients, and what we found is the prevalence of Type 1 Brugada pattern increased over the past 3 decades, from 1992 to 2021, that include about 5 million EKG and 2.3 million patients. So what we found is very interesting. The prevalence of Type 1 Brugada pattern in the United States is actually higher than we thought. The prevalence is very high, especially in the patients with Hispanic ethnicity. So this is a very new and unique finding, and we don't have any study that describe Brugada pattern in terms of epidemiology and risk stratification in patients with Hispanic before. Brugada syndrome is actually more common in Asian population, and it's reported to be very common in Asian, up to like 10 times when compared to white population. We also found that in Black populations, Brugada pattern is also as common as in white population, which have been reported before. However, in the white population, there was no study to compare between Hispanic and non-Hispanic. So what we found is in Hispanic population, the prevalence is actually more common than non-Hispanic. So we encourage more study about Brugada syndrome in the Hispanic population. We also have no study about risk stratification in Hispanic population. So if the patient who is Hispanic come with Brugada syndrome or Brugada pattern, we actually have really no data to really tell them what's the difference between their risk and their prognosis in terms of being Hispanic compared to non-Hispanic and compared to Asian population. So our study brings the concern that this unique population should be more interrogated, should be studied more. So we will learn more about Hispanic population in Brugada syndrome patients. This is a retrospective study, so there's a limitation about genetic testing and also cascade screening in the family. We could do prospective study in Hispanic population, also family cascade screening. So the next step of the research of this, our finding is more study in the populations of Hispanic population, genetic study in Hispanic population, risk stratification in Hispanic population, and as well as populational study. I would encourage all of you to read this article and see what our finding is, and then we can help together to research more in Brugada patterns and Brugada syndrome.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.